Hi, my name is Julia, and I'm going to be diving into the topic of what effect diet has on PCOS symptoms. I will be going over what PCOS is, what a Mediterranean diet is, 3 different case studies, and some recipe examples. Starting with PCOS. PCOS is a hormonal disorder in reproductive aged women. It can be characterized by irregular periods, excessive androgen levels, and enlarged ovaries with small cysts. Excessive androgen levels is just another way of saying high levels of a male hormone causing rapid hair growth. PCOS affects around 10 to 13% of women, typically around the age of 15 to 44, and PCOS is the leading cause of infertility. More symptoms of PCOS include severe acne, androgenic alopecia, which is hair loss caused by the excessive response to androgen, polycystic ovaries, which are just ovaries that are fluid-filled and fail to release eggs regularly, metabolic issues such as weight gain, difficulty losing weight, and insulin resistance, and skin pigment changes. Some of the risk factors of PCOS include genetics, such as any family history of PCOS, obesity, insulin resistance, environmental factors such as stress, lack of activity, poor diet, gestational diabetes, and high blood pressure. There is no cure for PCOS, but the symptoms can be managed by lifestyle changes, including diet changes. Moving into the next topic of the Mediterranean diet. The Mediterranean diet is just a dietary pattern, which is a way of eating that emphasizes plant-based foods and healthy fats. This pattern consists of regular consumption of olive oil, plant foods such as fruit, vegetables, legumes, tree nuts, and seeds, the moderate consumption of proteins such as fish or seafood, and whole grains. One of the benefits to the Mediterranean diet is the improvement of insulin sensitivity. By consuming fruits and vegetables and whole grains, this helps stabilize blood sugar, which reduces insulin spikes and ultimately can improve the body's response to insulin. It also reduces inflammation due to being rich in anti-inflammatory components such as omega-3 fatty acids when eating fish, antioxidants when eating colorful produce, and polyphenols when using olive oil. Improvement of insulin sensitivity and inflammation reduction both lead to the promotion of hormonal balance, which is the last important benefit I will be talking about. Due to improving insulin sensitivity and reducing inflammation, the diet helps regulate hormones, which leads to the decrease of androgen and promotes regular menstrual cycles. Now I will be talking about the first research study. This research study is about the association between the Mediterranean diet and the Prime Quality Diet Score and polycystic ovary syndrome, a case study control. The goal of this study was to investigate the association between adherence and the Mediterranean diet and the Prime Diet Quality Score and the risk of PCOS. This study was conducted using 472 women between the ages of 18 and 45, with 180 of these women having PCOS and 292 of these women not having PCOS. Dietary intake was assessed using a questionnaire about food frequency, adherence to Mediterranean diet, and Prime Diet Quality Score was calculated. A quick overview of the results are that there was higher adherence to the Mediterranean diet, and Prime Quality Diet Score was significantly associated with lower odds of PCOS. The highest quartile of the Mediterranean diet scores had a 41% reduced risk of PCOS. After adjusting for potential co-founders, age, BMI, physical activity, and energy intake, the highest Prime Diet Quality Score quartile showed 53% reduced risk. I have provided 3 different tables from the research article, and I'll go a little bit more into detail about them. Table 1 shows better dietary quality intake if you look in the 4th quartile. They were more inactive and tended to have lower waist circumference. Also, participants in the higher quartile of the prime diet quality score and the med diet score consumed significantly higher amounts of energy, protein, carbohydrates, total fat, low fat, dairy products, fiber, fruits, vegetables, legumes, whole grains, fishes, nuts, and lower amounts of high fat dairy products, refined grains, and then red and processed meats. Table 2, the results of accrual model showed that participants in the higher quartile of the prime diet quality score had a 53% lower odd of PCOS than the subjects in the first quartile. After controlling age, BMI, energy intake, and other potential confounders, higher adherence to the prime diet quality score was associated with a 43% lower odd of PCOS. And then for the third table, higher adherence to the Mediterranean diet and prime diet quality score was significantly associated with lower odds of PCOS. As you can see in quartile 4, there was a 41% reduced risk of PCOS after adjusting potential confounders. So, in conclusion, with all of these tables, higher adherence to these diet patterns was linked to lower risk of severe disease, reinforcing the potential role of diet quality. Now for our second research study. This study was about the association of the Mediterranean-style diet pattern with polycystic ovary syndrome status in a community cohort study. The goal of this study was to examine dietary patterns in a large cohort of women with and without PCOS. Dietary patterns were evaluated across 7,569 participants. 414 of those participants had PCOS and 7,155 did not. They were evaluated using factor analysis and multiple logistic regression assessed their associates with PCOS status. In a quick result summary, women with PCOS were more likely to consume dietary patterns consistent with Mediterranean diet. However, there was no difference in the other commonly consumed dietary patterns of unhealthy non-core foods or pattern higher in meat. Here are 3 tables that were provided by the article. In Table 1, the women with PCOS were around 2 months younger, were more likely to not have children, and had a lower prevalence of currently breastfeeding compared to women without PCOS. In this table, women with PCOS had an elevated energy and fiber intake and lower glycemic index and percent energy intake from saturated fat compared to women without PCOS. Women with and without PCOS had similar physical activity levels. Table 2 shows the dietary pattern analysis revealed 3 distinct patterns explaining a total 27% variance. The first pattern was labeled non-core foods as there were high factor loadings for cakes, biscuits, sweet pastries, and refined grains. The second pattern was labeled high meat and takeaway as fish, fried, processed, canned, and cooked, processed meat, red meat, but also takeaway food highly correlated in this pattern. The final pattern was labeled Mediterranean style as Mediterranean type foods highly correlated to this pattern, including a variety of vegetables, fruits, and nuts. Small correlations with fish, while crisps were inversely correlated. And for Table 3, reports the results from logistic regression. For each one increase in the high meat, fish, poultry, and takeaway pattern, there was a 9% greater likelihood for women to have PCOS. However, this association did not remain in the adjusted analysis. In the crude analysis, for each one increase in the Mediterranean-style diet pattern, there was a 15% greater likelihood for women to have PCOS. The association was strengthened after adjusting for maternal age, maternal BMI, breastfeeding, number of children. And after all of that, for every increase in the Mediterranean-style dietary pattern, there was a 26% greater likelihood that the woman reported had PCOS. There was no association between unhealthy non-core foods patterns and PCOS. These are explaining that there is a greater likelihood that women that have PCOS use a Mediterranean-style dietary pattern, which correlates back to how the Mediterranean diet can help PCOS symptoms. And finally, onto our last research study. This study was a high-fat diet exposure from prepubertal age induces polycystic ovary syndrome in rats. The goal of this study was to examine both reproductive and metabolic features of PCOS in prepubertal and adult female rats. In the diet section of this study, the prepubertal female rats were divided into two groups. One group received normal pellet food, and group 2 received high-fat diet. In the letrozole study, adult female rats were divided into two groups again. The first group received a 1% carboxymethylcellulose, and group 2 received 1 milligram per kilogram letrozole orally. Quick overview of results. Rats on a high-fat diet at a prepubertal age showed slow and progressive production of metabolic disturbances and ovarian changes that mimicked very closely in clinical PCOS patients. Rats on the letrozole rapidly induced changes in ovarian structure and function without producing metabolic disturbances. These are two figures of images of the rat's ovaries. The first one shows images of how letrozole affected the rats, and the second figure is how a high-fat diet affected the rat's ovaries. So, ovary weights of letrozole-treated animals were significantly higher than those in control groups. In contrast, in high-fat diet-fed animals, the ovary weight remained unaffected. Multiple ovarian follicles and less numbers of corpus luteum were observed in letrozole-treated and high-fat diet-fed rats, as compared to few ovarian follicles and large number of corpus luteum in control rats. Follicle diameters were also higher in both test group animals as compared to control animals. However, letrozole-treated animals had greater follicular diameter than high-fat diet-fed rats. Additional changes observed were thin layer of granulosa cells, hyperplasia of theca cells, and atrasia of follicle. During atrasia, ovum degenerates and granulosa cells undergo apoptosis, which are replaced by fibrosis material, and that is all seen between figures 3 and 4. To conclude this, I'll just briefly mention a couple examples of Mediterranean diet style foods. We have roasted salmon and vegetables, tomato basil pasta, chickpea salad sandwich, berry chia pudding, Southwest breakfast skillet, and lemon chicken potatoes with kale. There are many other options that you can look up online. There are many websites that offer Mediterranean diet style recipes. Thank you.